Inoperable is pretty much the worst word that you can hear when you have a brain tumor. My name is Katie Lewis. I live in Glenwood Springs, Colorado, and I'm 32 years old. When I was 7 months pregnant with my third son, I noticed that my right eye stopped tearing. I was told over and over that it was nothing and had tons and tons of tests done and saw probably 20 plus doctors before anyone ever really took any of my symptoms seriously. About a year later, I actually started having double vision while driving on the Las Vegas Strip. Not a good place for double vision. When I was told that the double vision was permanent, that's a horrible, horrible thing. I mean, it affected everything that I did. The doctor who we saw that told us that it went before a tumor board, and they all decided it was too dangerous to do surgery, and he told us that getting a second opinion would be a waste of our time. And I think him saying that was a red flag to me. It just kind of solidified that I needed to go elsewhere. So I learned about the teleconsult program at Cedars, kind of honestly a late night search, frantically trying to find any other option. When I started doing research to find somebody with a second opinion, I found Dr. Black. I mailed my images from my MRI to Cedars. Dr. Black reviewed them, and he referred me to Dr. Alexander.
When I was first introduced to Katie, we noticed that she had a tumor that was very vascular, and what we wanted to do was to get her to the specialist and neurosurgeon in our group that had the most expertise in dealing with the type of problem that she faced.
When I had the teleconsultation, I genuinely felt from the moment that we started talking that he, first of all, had reviewed my MRIs. He had a plan, whereas other times I would go into a doctor's office and they would sit there and pull it up in front of me and quickly glance over it like it was an afterthought.
Katie's tumor was at the very bottom of the skull where the carotid artery comes through and the nerves that control the eye and also some of the nerves that go out to the ear. This is a complex tumor, so it's not the type of tumor that a generally trained neurosurgeon would try to attack. But for neurosurgeons who have specialty expertise in skull-based surgery, this is an approachable tumor.
When we found out that the surgery could be done here, my family actually all drove here. I think I tried to stay really positive, but it's terrifying. I guess I had a peace about it though, because I knew that I was coming to the right place and I knew that this was the answer that I had been looking for. But I think it's scary for anybody. After surgery, they were optimistic that it could change the double vision, but there was no guarantees. That was something that we discussed on the teleconsult. Exactly 14 days after my surgery, my husband and I were driving to get the staples taken out, and I had been looking down and I looked up and I saw one, and it was, I think I half laughed, half cried. It was just incredibly overwhelming to, just like that. Nobody expected it to happen that quickly. So it was incredible.
It really benefits the patient to get a second opinion. Your first opinion is not always the best. And there are different options. You may not have a specialist at your local hospital who can deal with the problem, but this teleconsult technology gives you the opportunity to see a nationally or internationally known specialist for that problem.
I think a lot of people think it's black and white, and if a doctor tells you something, then that's the answer. It's absolute. I think you have to be your own advocate, because it is hard to find somebody who is really invested and really deeply cares. I think during the whole ordeal, my kids were really the thing that I had a really hard time thinking about, like what if I wasn't at my daughter's wedding, or what if I wasn't at my boys' football games? You think long term what that looks like. So I feel like now I don't take anything for granted with them. I feel like the little moments are special, and I realize what a blessing, not that I didn't before, but it's different. Like you look at life through different eyes.
A lot of times, patients need an immediate answer. They have a condition where they need to speak to someone right away that day. So we try to make every effort through our system here to get the patient to the right doctor, the right specialist, to be evaluated timely, and to get them the help and information that they need.